us. We are privileged again to have mental health experts, domestic violence experts. So today we are having very, very well-informed ladies from the diaspora, let me call it Minnesota, who are going to teach residents of Minnesota and specifically Hennepin County on the effects of mental health, the effects of domestic violence, how we can tame this particular vice. It's really a pity in the society that as of today, we have so many cases of domestic violence. And some of these cases are actually as an effect or as a result of mental health. So today we are having experts who are actually going to expound more on this particular topic and teach the community on ways and means to ensure that we live peacefully, we live cohesively in this era of COVID-19 pandemic. So please, welcome to KDR TV Live, and if you have got questions, please share those questions using the hashtag KDRTV Live so that these experts can answer those questions. So right now, I'm bringing in the mental health and domestic violence experts, and in a few seconds, you're actually seeing them on the screen. Oh, ladies, welcome to KDR TV Live. How are you doing today?
Doing great.
Thank you very much. So, let me first of all introduce Ngozi Akubuike. She is a mental health expert, at the same time, an expert in domestic violence. So today, she'll specifically teach the community on how to detect. First of all, detection. The second thing, prevention of domestic violence. So Ngozi Akubuike, can you please introduce yourself so that viewers can know you? Go ahead, Ngozi Akubuike.
Hi, my name is Ngozi Akubike. I am an attorney and also a counselor, and currently I'll soon graduate from a restorative circle mediation program that will provide an alternative way to resolving issues. It gives individuals the power and control to resolve issues on their own. I am also a 2020 candidate for Ramsey County District Court Judge in the just concluded election. I have been an attorney both in here and in Nigeria for many years. And I have worked in various areas in the county attorney's office, where I worked in the area of domestic violence as well. And I bring a perspective of being both a survivor and knowing what it means to undergo domestic violence. And I present myself, I make myself vulnerable so that other women can have the courage to live if there be need to leave any violent situation that they are in. And I'm hoping that today's session will create a greater awareness within our community, as well as encourage and empower women to come out if they are living in a violent relationship. Give them the courage to come out and not have the shame or think that it is their fault that they suffered domestic violence. Thank you.
Thank you very much once again, Ngozi Akubuike. Now let's introduce Dr. Judy Onduso. Dr. Judy Onduso, please introduce yourself to our viewers.
Thank you so much, KDR TV, for giving me this opportunity again to come and speak to our people. And I also want to thank the Mwanyagetinge sponsor for allowing us also to be able to educate our community and be able to allow them to know that there are resources during these difficulty times. As I was introduced, my background is in family practice, and I have worked in many areas in nursing field and medicine field as well. So I have been also a member of the community groups and also person who loves people. So I'm so glad, and mental health is actually mental health topic and how to manage and mitigate this has always been my passion, because I've also, even in my younger life, that I not only struggled as a younger person in adolescent stage, but somebody who continues to see the patients in day to day and able to help them as well to overcome their struggles. So I'm so happy that we're going to journey together on this, and I hope that you will learn something that you either can help yourself or somebody that you know. Thank you.
Thank you very much, Dr. Judy Onduso. Now let's bring on board Sister Nelly Torori, who is a mental health expert actually working with the Hennepin County, if not Minnesota State Mental Health Department. She is a very good lady who understands this topic more than most of us. So, Nelly Torori, in Swahili they say uwanja ni yako. The field is yours. Please introduce yourself.
Thank you so much, Mr. Kigwato and KDR TV, for this opportunity to be able to be here to share some of the resources and for our community also to be part of this conversation. As you heard, my name is Nelly Torori, and my background is in mental health. I am a mental health licensed professional, and I work for the state of Minnesota Department of Human Services in the Behavioral Health Division, where I have worked for the last 8 years. My role there really is around program and policy consultation, where I work with programs that are delivering mental health and substance use disorder services. So there's a lot of work that we do around the policies that we have and also the quality of the services being delivered. So I am really privileged to be here, and I really want to thank Mwanyagetinge. I'm truly humbled to be here. So for us to have this platform where we can talk about a topic that is near and dear to my heart, and a topic that we really would want to collaborate with our community and see how we can mitigate the symptoms of mental health, mental illness, and also what we also know as substance use disorder. So we really want to know what are those and how can we mitigate those symptoms. So thank you so much for the privilege and the opportunity to be here.
Thank you very much, Sister Nelly. I would love to remind our viewers that this program is co-sponsored by Mwanyagetinke organization in collaboration with the Hennepin County. So, from the information I got from the Mwanyagetinke organization is that they have a continuous membership registration, and if you want to be a new member to this organization, you should contact, or you should write a message or call the number here, 763-742-0123, or write an email, mwanyagetinge.org@gmail.com. So as we dig deeper into the discussion, the first person actually to do a presentation, this is not going to be an interview or a debate. The first person actually to do a presentation is our sister, Nelly Torori. So Sister Nelly Torori, if you are ready, let's start rolling. So Sister Nelly Torori, uwanja ni yako. Go ahead, sister.
Thank you. All right. So again, I'm privileged to be here, and thank you, Mwanyagetinge, as we have alluded to, for making this possible for our community members to be able to learn and to also tap into the resources that we have in the community through this platform that we are going to use today. So with that, I am going to go through the presentation, and I will try to go as fast as I can. I have a few minutes to go. So we can move on to the next one. And my role here really in my presentation today, let's just look at what are some of the objectives for this presentation. If we can just move to the next slide. So here we want to look at the one before that, the objectives for today. Let's have the first slide that talks about our objectives for today.
Objections.
So we are going to be looking at mental health and mental illness.
Okay, because
and so I'll be telling you when to move to the next slide so that we can just move together on the same pace. So let's keep moving, and I'll let you know when to move. Let's move to the next one.
Next one.
And the next one.
Yes, go ahead. Okay, the objective.
All right, right there.
That is okay.
So that the viewers can also follow along. So my objective for the presentation for today is to look at what is mental health and mental illness. I know many times we use those two terminologies interchangeably, but what do they really mean? Then just look on what are some of the mental health conditions and how to identify them. I know there's quite a number of them, so I will not be able to really go into all of them. As you know, if we look in our DSM-5, which is known as the Bible for mental health and mental illness diagnosis, there are quite a number of them. So we may just look on a few, especially the ones that pertain to mood disorders and the behaviors. And then we will look at how also to recognize the impact of COVID-19 on mental health and the effects on general functioning. We are here really today because of the pandemic that we are all experiencing, that we are all getting the heat of the effect of COVID-19, and how does that impact our mental health functioning. Then we'll also look at some of the strategies around resilience. What do we need to do to really bounce back, and how can we still thrive amidst the pandemic? And then just we'll share a few other resources after that. And then it will be followed over by Judy, who will continue on with our discussion in terms of what the mental illness looks within a treatment facility and more that she has prepared for us today. So with that, let's move to the next slide. What is mental illness? When we talk about mental illness, we know that, let's talk about mental health first. This is really the foundation of thinking, communicating, learning, resilience, and self-esteem. So mental health really is when it involves effective functioning in daily activities. And those functioning also results in having productive activities such as work. You wake up every morning, you go to work. For students, you go to school. And others who are providing care to their loved ones, you're able to provide the needed care. And also we are able to really be involved in fulfilling relationships and other abilities to adapt, to change or cope with any adversities such as the COVID-19. So when our mental health is, our mental health is perfect, or let's say we are able to cope with this, then we'll say that is what we call mental health. Then what does that mean by mental illness? So mental illness, we are talking about situations where there's significant changes in our thinking and emotions or behaviors. So it can be a combination of all those. So mental illness is usually associated with either distress or problems in functioning, and you're not able really to function to your full potential. So when we talk about mental illness is when you are not able to do what you would normally do. And that time, then you're not functioning to your full potential. So some of the things that we talk about when we refer to mental illness, we are talking about significant changes in thinking, the emotional behavior, where sometimes you think in your thought process is not in check with the reality, or also some distress or problems functioning within society, within your social setting, work, or family. So those are some of the things that we are going to be looking at as it pertains to COVID-19. How does that impact our functioning? So let us always keep in mind that around mental health, really we are talking about wellness, and also mental illness is when that wellness is compromised, then you're not able to function. Let's move to the next one. So we just want to look at what do we know about mental illness. If we can move to our next slide. So there's just some data here we want to look at, just to really give us the prevalence of mental illness and really to remind us that mental illness is real. I know there's a lot of stigma around mental illness, but we want to be reminded that Just like any physical condition, mental illness should be considered as an illness that is treatable, and it is real and it's affecting our community. So according to the National Institute of Mental Illness, on Mental Health and Substance Abuse and Mental Health Service Administration, which we call SAMHSA, we see that mental illness is common, and nearly 1 in 5 US adults experiences some form of mental illness in a given year, or 1 in 24 has a serious mental illness. So there are some that are considered mental illness and others severe or serious mental illness, and that they have to rely on medications to be able to function. And then also we see that 1 in 12 has a substance use disorder. Mental illness is treatable. So once we intervene early, we know that people can bounce back and move and live their lives and be able to function to their full capacity. So the vast majority of individuals with mental illness continue to function in their daily lives when they are continuing with their treatment as prescribed by their providers and when they are continuing to access services. Let's move to the next slide. When we move to the next slide, I just wanted to talk about this particular slide. And this is data that we have from our Okay, so the data that is displayed on the screen there, that is, we have the National Association of Mental Health, where they conduct a survey each year. And the National Survey of Drug Use and Health uses this data really to provide a window into the state of substance use and mental health issues in the United States. So as we see the diagram there, we can see that there is alcohol use, and this particular one I pulled out focuses on the African American. That's where as African immigrants and other communities of color fit in as Africans. So I just want to, So I want us to, let's just stay on that slide for a minute. So there, as we can see, why do we want to be able to collect, why does the National Survey on Drug Use and Health collect this data? You can move to that next slide. We use this data to really help guide policy directions in addressing problem substances, prevalence of mental illness, and the intersection of substance use and mental issues, and also provide insights that can be studied in the context of data and other agencies to help in decision making about types and resources that are needed and where they should be directed. I will be talking more about this later towards the end, but to show really why it's necessary to be able to provide those satisfaction surveys that come through our mail, or some of the things that we are required to really give our feedback in terms of what was the quality of service like, was it beneficial? Because we see that we are dealing with a situation here of mental illness, and therefore the services we are receiving needs to meet those needs. And that's why these constant surveys are going out each year to be able to inform if those services are meeting those needs. So let's move to the next one. And so talking about the surveys that are being conducted, if we can move to the next slide. Now I want to really look at what are some of the common mental health conditions that affect mood, thinking, and behavior. Remember earlier we talked about mental illness really is when is the ability of not to think or be able to, when your thought process, your behaviors, and you're able not to be able to, they're not according to how you would be functioning normally. So when we talk about some of the common mental conditions that affect the mood and thinking and behavior, we have depression, anxiety, bipolar, dementia, attention deficit disorder, schizophrenia, obsessive compulsive disorder, autism, and post-traumatic stress disorder, commonly known as PTSD. I selected those among many others that we have, primarily because those are most of the conditions that really affect the mood. They are considered also as a mood disorder. So mood disorders. So when you talk about a mental disorder, this is a wide range of conditions that affect our mood, our thoughts, and our behavior. So talk about depression, which is one of the most common diagnosis that is diagnosed, and depression. So that depression is a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. And most of these conditions that are listed here, one way for us to really detect and see if we are not functioning to a normal capacity is when you find that some of these symptoms that we are talking about are persistent for more than 2 weeks. So that's when it is a concern, because usually you can get, you can be low when you're not meeting things that you need to, you are having, maybe you've lost a family member, or you have this target of what you'd want to do, but you feel you're really struggling and not meeting that. That is normal, as long as it's not really affecting you to a point where you give up in performing your normal duties. So, and that is what I would say. Always let's pay attention to see how are those symptoms manifesting, and are they lasting for more than 2 weeks. When we talk about anxiety disorder, that is also a disorder characterized by feelings of worry, excessive worrying, a fear that also has that strong interference of you being able to function in your daily activities. An anxiety level that sometimes can affect you to not even want to leave your house. So when you realize that you're having such symptoms persistent for 2 weeks or more, then that is a call for you to seek help. And I see the next one we have is bipolar. Bipolar also is a disorder that is also associated with episodes of mood swings, ranging from depressive lows to manic highs. So, you find someone, you're good, in a good mood, you're enjoying each other's company, everything's going well. All of a sudden, it just turns out like night and day. Those mood swings from highs to lows. So that is when, if those moods persistently come for 2 weeks or more, then that is a need for you to be able really to get seek help and have an assessment to really be able to determine if that is bipolar that is being manifested. And then we have dementia. I know most of us are familiar with dementia, which mostly we relate with it to our elderly. So this is also a group of thinking and social symptoms that interferes with daily functioning, because we tend to really find that we forget things. And then with that, whenever your stability is compromised, then it brings all these symptoms. And then we have attention deficit hyperactivity disorder. This is most commonly diagnosed in children, but even adults also have it. So this is also a chronic condition where there's attention difficulty. You're so restless. You're being jumpy, moving up and down. You can't complete one task. You go to another one. And it also has hyperactivity, being very active, and also impulsiveness, being repetitively involved in something and really wanting to get it done in a manner that is, that is just not the normal way. And then we have schizophrenia, a disorder that affects a person's ability to think, to also feel and behave clearly. I know schizophrenia is one condition that also raises a lot of sometimes challenges to diagnose, in terms of, because of the way it presents. But when you recognize that you're having issues to a point where some of your thoughts are not in check with the reality, then you do need to be able to seek advice from a mental health professional or your primary doctor, so that assessment can be done. So we have obsessive compulsive disorder. This is also excessive thoughts or obsession with doing something repetitively. It could just be as simple as checking your thermometer in the house. What is the temperature? You go and you set it, and then you see it, and then your mind goes like, hey, did I do? Then you keep going. So really doing a behavior repetitively without, understanding that it is already done, but you want to constantly do it. Or just cleaning, you're just obsessed with cleaning. So when you continuously do that in a manner that is not appropriate, in that when you're done, you're comfortable, you're done, but you have these thoughts that constantly keep reminding you that you need to do that action again, then that is the needs for an assessment. Then we have autism, which is also another condition that is very prevalent within our community. This is a serious development disorder that impairs the ability to communicate and interact it is more of a developmental disability as well for our kids, intellectual development disorder, where the child is delays even in their speech and being able to things that are age appropriate. And then lastly, we have the PTSD, which is post-traumatic stress disorder. So this is also a serious disorder that affects a person based on an event. So a person has difficulties recovering from experiencing or witnessing any terrifying event. It could be maybe someone witnessed someone being shot, or like, let's say, refugees or individuals back home during war. You're in a war-torn country and you witness people being massacred, and then you find that those memories, the pictures of what you saw, those graphic pictures, you constantly keep having them when you're going to sleep, or even sometimes you get startled by those gunshots and all those. That's one of the symptoms for PTSD. And we know that PTSD can be triggered by anything, even as with the current pandemic, with the heightened fear, and also being able to not to know what is next, just the fear of the uncertainty. That can also trigger some of the symptoms for post-traumatic disorder. So it's always good to really, bottom line, when we talk about mental illness, it's when it's not, we are not paying attention to our bodies, to be able to recognize symptoms earlier on, because it is treatable. So being able to always think about mental wellness. I like to talk about mental wellness. What does that look like? So that if you're not feeling the way you're supposed to, which should be considered wellness, then there is need for you to seek help. So let's move to the next one. I pulled out these two particular disorders, mental depression. Let's stay on the one that we was, the depression and anxiety, because they tend to overlap. Let's move back right to that one. So depression and anxiety, because they tend to overlap. But then, as we know, depression is when your moods are low, and high anxiety is when you're high, you're having all this fear. But we know that usually with depression, it's based on a past situation or something that didn't work out very well, and you constantly continue focusing on that. And whereas anxiety tends to be more future or something that you're anticipating. Sometimes it's considered like an anticipation disorder, where it's something you're expecting to happen. So anxiety and depression are believed to stem from the same biological vulnerability, and they go hand in hand. So usually when you're being diagnosed for depression, the clinician also needs to look at if there are any symptoms of anxiety with it. And some of the common signs and symptoms are really feelings of helplessness and hopelessness, just loss of having your daily activity, interest to go about your daily activities. You see a change in your in your appetite. Excuse me. One of the other thing also is being very irritable. Just having anger or easily irritated. And others could also have symptoms of really being careless, where you're just spending and just having some reckless behavior. And also there could also have just aches, body aches that are really unexplained. So we need to really consider some of this when we are doing when we are assessing someone for these symptoms. And as I will be talking later, we want to also remember that as when we are making when someone is being assessed for a possibility of a mental illness, we need to really make sure that we are connected with that person, and the information being shared is really going to articulate well for you to be able to rule out others and be able to identify what the diagnosis is, because it's very possible to really misdiagnose someone, especially if there's no connection. So there is really a value to have whether it's a doctor or clinician, whoever you're seeing, that you're really connected to be able to have that done appropriately. So it's really important to recognize both of these symptoms because of their manner to really overlap in some ways. Let's go to the next one. So now that we've been talking about mental health, mental illness, I wanted to just also look at what are some of the impacts of COVID-19 to mental health. As we know, someone with a mental illness, it means that you're not functioning to your normal capacity, to your normal potential. So anything small really destabilizes you. Anything small can trigger some of those symptoms. So here we are in a pandemic. And one thing I think we can all agree to, this has been the most challenging time that we've all have had to face. However, we do have resources that we can use once we are able to recognize some of this. So as we know, the outbreak of COVID-19 may be stressful for us. There's fear and anxiety about the disease. And we know this can be very overwhelming, especially for someone with a mental illness. But being able to identify some of those symptoms earlier on and being able to mitigate, we can be able to still thrive amidst the current pandemic. So some of the things, the stress during a pandemic like COVID-19 are fear and worry about our own health and also those of our loved ones. Remember, we are watching news and then you're hearing people are dying and you're hearing the number of infections going high and all that we are consuming from the media. That can raise anxiety, especially in someone with mental illness. It can be uncontrollable. And we see some folks are already having changes in sleep and eating patterns. And there's difficulty concentrating or even falling asleep or staying asleep. Some of the things we see may be normal, of course, during a pandemic, but when they get to a point that we are not able to function, then we need to seek intervention earlier before it escalates into a crisis. There is also, we know with the COVID, yes, there is worsening in mental health conditions and obviously even in our chronic health conditions. So we've also seen increase in the use of alcohol and other drugs because people are really trying to find a point of meaning with all this uncertainty that we are all dealing with. So we are in So we all need to always check on each other, checking with our loved ones so that we make sure that at least we are there for one another. Let's go to the next one. So as we're talking about mental illness, or it's the symptoms could present differently in a child versus an adult. So we need to know that as an adult, and as I said, the symptoms earlier that for depression and anxiety, some of those could be the similar symptoms for an adult who is also coping, especially at this time with COVID-19. So one thing we really need to pay attention to is our behavior. We need to be able to recognize some of those stressors. What is stressing us that is affecting our behavior? How is our body reacting to the current situation and our emotions? So we always have to keep that in check. Because we know once you find yourself having some of the symptoms I talked earlier, you find that you have a decrease in energy or activity levels, or you're just being irritable. And you're just having difficulties even making decisions. Those are some of the symptoms that COVID can have on someone with a mental illness, because there's just so much that is going on that we need to always be aware. How are our thoughts right now? Sometimes you find yourself, you're forgetting things, you feel confused, or just being that mind being foggy. You're not able to concentrate. Those things can happen during a pandemic, but if you're having those symptoms to a level that you're not able to do your day-to-day activities, then we need to be able to find ways of mitigating those symptoms. And we have many ways that we can look into that. So being able to keep yourself healthy. What are the foods that we are eating? We are usually discouraged from eating these highly processed foods that can actually also trigger some of the symptoms because of the chemicals they're processed in. Using practical ways to relax and also just being able to pay attention to your body. What about our children? So looking at the kids, of course, we know that stress affects even children. And many times for children, it is normally displayed in their behavior. There we can see also our kids are having mood swings, acting out. They have also changing their sleep pattern and many other things. Even academic is affected. All of a sudden you find the academic level is dropping and they're not even able to keep up with school. Talk about social learning. Our kids are learning at home. That is a challenge of its own. So there's a lot of things that we see that can affect our kids, but we as adults in their lives, we can be there to mitigate some of those symptoms. So what are some of the things we can do to our kids? Is really listening and paying attention to the children. Let's allow them to vent, to talk about what they're going through. How are they processing the current situation? Sometimes finding time to just have a conversation to see where they're coming from. And we need to also be able to show some affection to our kids, lots of hugs and kisses, and just being able to just show the kids that we are there. I know we're busy with our lives, especially as immigrants. We have schedules here, but please just spending time to really make time for our kids each day. Let's move to the next one. So I just put that. I know we might not be able to see this. This is a diagram that it also just talks about some of the symptoms that I talked, which is, it's more like, what do you do? What do you do to determine that your symptoms are really interfering with your daily life? And once you get that, and remember I said that once you have those symptoms and they last for more than 2 weeks, then yes, you need to seek for further evaluation. Or if there are some, and then or if you have folks within your social setting that you can connect with to really mitigate some of those symptoms, because we know, especially with the physical distancing and the social distancing, it can bring some loneliness. So we can also use the benefit of using family or loved ones or friends just to be able to check in on each other. So also we do have professional help. Please, we should never, I know there's stigma around some of the mental illness symptoms we talked about, but these are really symptoms that these are symptoms, if we normalize, are just the way someone would be having physical symptoms when they're having a medical issue. So we need to really start destigmatizing mental illness and the symptoms, because that on its own can make people really live with their symptoms without accessing services until it gets to a crisis. Let's move to the next slide. So now that we've known about mental issues that we could, and symptoms during COVID-19, I put that diagram, and we may not be able to see it, but this is really a diagram that helps us to do what I call a temperature check. I saw this diagram once, and I thought this is something that we could use. And I know at the time when COVID came the first time, people were all over, trying to make sure that we are stocking our pantry with what we need, because it was really more of the fear of the unknown. So the question is, who do you choose to be during COVID pandemic? Who do you want to be? We have those 3 learning zones, and those can really help us. And those are zones that we would want to look at and see, where do I fit? And you may fit in more than one zone, but it helps us to really see where we are. And it can be one of the ways for us to really see, do we need to work on our emotions or how we are reacting to this pandemic. So you see, in the fear zone, that's where we are busy grabbing food, toilet paper, medications, and all the things we need. And we are always constantly complaining or just forwarding every message you get. We are forwarding it about COVID. You just keep doing that. But then being in the learning zone, here is where now we stop compulsively consuming what hurts us, even news. Sometimes we take a break from it. And then here we will start now giving up some of the control, because we feel that we need to own everything. And being able to pay attention to our emotions, just really checking in, how do I feel? How am I reacting? Why am I reacting this way? So really becoming aware of the situation, and also being proactive. What do I need to do? And also being able to evaluate any information we are getting. Before you forward it or do anything, we need to really be able to check it for facts. Is it real? Is it something that I need to share? And also we are talking about being now in the growth zone. That is where we really want to see all of us to be. This is where we are thinking about us, ourselves, and others. How can we be helpful to others as we also trying to help ourselves? So being able to know what we are good in and being able to share that with our community. That's where now our community value comes in. Being able to live in the present and focus on, and we live in the present, but we focus on the future in terms of how do we need to improve things in a positive way. Also being able to be empathetic with others and even ourselves, being kind to ourselves, and just learning to appreciate each other and keeping ourselves happy, really our emotions, and just being able to adapt with what is going on. So let us move to the next one. So as we've been talking about that, we need to know, how do we bounce that? So this is where now we need to look at, how do we react to the current pandemic? Do we need to be the ones that are always in that fear zone, or do we want to move on to the growth zone? We have some strategies here for resilience. This is where, once we are able to really stay in tune with our emotions and our actions and our thoughts, and we are in control of that, then we are able to seek emotional support. When we realize that I feel so low today, I don't feel like I'm really up to even getting out. Why do I feel that way? Let's get support. And then also being active. We always talk about our bodies. When we sit down and we keep eating and just sitting down, then our mind gets clogged. It is okay. We need to be creative. What exercise do you like to do? Identify something that you enjoy doing and keep physically active. We also have positive reappraisal or reframing. Can I look for something good in what's happening without always thinking about the pandemic being negative? Some of the things that have been positive, families, in as much as we've seen high rates of also domestic violence, but there are also families that are really reconnected, checking on each other more often. Zoom is being used to a high level that it has never been, because families are connecting through technology and also doing some positive self-talk. We need to always do some active coping skills so that we are able to stay in touch with what's happening without finding ourselves falling through the cracks. So let's plan ahead and also try to create strategies of what do we need to do and be the support for others as well. So the next one. So that reminds us that we need to always remember, what is our mental health? Awareness, adaptability, decision-making, and positive thinking. What does our mental health status look like? How about physical? Are we being active? What is it? Do we have endurance, nutrition, recovery, and strength? What is it that we are doing that is giving us all those positive things that we need that will promote healing and also coping with the current situation? And then we have the social, which is more around the connectedness, connecting with family, communicating with them, and really being a team part, be part of a team. And I thank Mwanyagetinge for bringing this together so that our community can really know that we are together, we are not by ourselves. Being a community brings healing and it promotes well-being. And also the spiritual cause. Some of folks, having our spiritual values. What are those values? And are we staying true to those values? So what are we doing that really give purpose and bring meaning to our lives? Those are some of the things we need to do at this time. Let's move to the next one. I have a quote here in the next slide. If you can just move next. So this is a quote that says, to get to our next level of greatness depends on the quality of our culture, which depends on the quality of our relationship, which depends on the quality of our conversation, by Judith Glaser. I love this quote because this really reminds us of the need, the value of being a community, of being together, and a value of being able to really identify the conversations we are having, even if it's through WhatsApp, whatever forum we're sharing. Are they meaningful? Are they building us? So those are some of the things that also can affect our mental well-being. So you may think that it's just maybe a communication that is being used, but if it's not positive, it is not promoting, it can affect us also negatively. Let's move to the next one. So this is where I know I threw this in. We may not see some of the slides that I have, but this is where I like to talk about culture. As I talked earlier, the work that I do really looks into cultural specific and being culturally respective, culturally sensitive, name it, everything, but a service that really ties to the individual that you're working with. So we are talking about being able to provide those services, but to do that, how do you know that? Most of you are familiar with the cultural iceberg, and we know that for the most part, what is on the top level, what we see on the surface is really very most of the cultural values that we see on the iceberg really are underneath the surface. So that's why it is always very important that when you're seeking services, you are the expert of who you are and what your values are and what you believe in. So that is when you need to use those resources to educate the clinician, whether it's your doctor, to be able to provide the services that will meet those needs. That's why I put this up here, just to show us that sometimes maybe you can go to your doctor's office or a clinician and we just assume that they should know everything. But how does culture impact how you perceive mental illness or how you even receive services? So we need to remember only 1/10 is above the iceberg. But the 4/10 is right below the iceberg, which is really shallow around personal level with unspoken rules and other knowledge. But majority of that is really beneath the iceberg. And that is where we have the deep culture. And I bring this because I know as Mwanya Getinga, we've talked about this. We need to educate ourselves of who we are and our values so that we are able, even the services that people need to access, really to meet people's needs at this time of COVID, they address some of those needs. Let's move to our next one. So, and that is why I put my favorite quote there from Mr. Mandela at the late. If you talk to a man in a language he understands, that goes to his head. If you talk to him in his own language, that goes to his heart. That speaks volume. Why do we need to have culturally specific services? Why do we need to have more providers that look like us? Then we can be able to relate. If I find a provider that I can speak to in my language, trust me, we don't need to take 2 sessions to try to connect on that level. It will just be instant connection. So that's why we need to be able to articulate when we are seeking services, and if they don't meet those needs, how do we ensure that those services are meeting those needs? Let's move to the next one. So to be able to do that, we should be able to really be able to identify, when you're thinking about accessing services, find a mental health care that fits your cultural background. When we talk about a provider that is culturally competent. So we talk about culture being particular groups, beliefs, or custom values, or the way of thinking. So we always have to look at the services that we are receiving from a cultural lens to make sure that they do meet those needs, because otherwise that's when there's a disconnect, and then people end up not showing up for services. They stop going because they don't connect, and then we end up having so many individuals in our community that are struggling with mental illness just because they're not connecting with their provider, or there's a miss, or there's that lack of cultural understanding. And that's why we also talk about cultural competence, where also providers need to educate themselves to be knowledgeable around the diversity of the people of Minnesota that we serve. So let us also be actively involved in being able to speak what is of meaning to us. What do we value as individuals? What will promote our well-being? That can only be communicated well and authentically from you as an individual to the person who you are seeking services from, so that they can be able to use that to provide the services in a more culturally appropriate and competent way. So next one is where you need to think about what do you do, some of the tips to finding a culturally competent provider. So do some research before, ask folks who have worked with providers so that you know, who do I need to seek access services for? And also ask questions. Sometimes we tend to be afraid of the providers. We actually should not. Let's ask questions, especially right now. Families are handling COVID-19 differently. Let us ask questions based on what we are seeing in your own home. Then out of that, people start working from there now, trying to address some of those needs. So there are many things that we need to look at when it comes to accessing services. Always make sure that you are connecting and what is being conveyed. At times we use interpreters. We know that there are times there's no language, especially with mental health. Some language, there's no language in our language sometimes that can articulate a terminology in English for that particular condition. So when someone is speaking in your language, you tend to give or describe by giving symptoms, what they look like. So if that is what it takes, you can take the time to do that so that we are able to address a condition that is available. And to finalize that, let's move to the next one. So now I'm just going to move on. What are some of the resources that we have that can really now help us? Once we've talked about mental illness during this time, we've talked about now you're supposed to really be able to recognize and be able to access services. What are some of the resources that we have? And as a community, as a culture, some of those who are faith-based communities, we tend to connect very closely with our pastors or our spiritual leaders. So we do have some resources also that have been put together to guide the faith-based leaders to be able to really know how to interact with their congregants and to be able to direct and support them and refer them to the right services. Once that is done in a systematic way within time, then intervention will be done before it lands into a crisis. So there's two resources there that I really like. They're online. One is the Mental Health, a guide for faith leaders, and the other one is Compassion in Action, a guide for faith communities serving people experiencing mental illness and their caregivers. This was put together by a group of a large number of faith leaders and mental health experts to put together those resources. And one thing we know, when we are knowledgeable with what is, then we are able to see how should that fit within my cultural community. What should that look like? So many times we know some of the research done sometimes is not, the subjects are not people from our cultural backgrounds, but we can use that research to tweak so that it really speaks to who we are and how that should address our needs. Next one, we do have some other resources here in Minnesota. So we do have resources online. If you go, we have warm lines. There's numbers that I've listed up there that you can call and speak to someone that if you just need some counseling, there's numbers you can call, or the text, you can text for to talk to someone on the other end, a mental health crisis counselor to talk to you. Or we do also have crisis lines, the 272-274-747. Which is star crisis on your phone. If you press star crisis, that one will be answered by a mental health professional that will be able to talk to you. We have that number across the state of Minnesota. And then from there, they'll be able to redirect you to the right resources. But again, remember, you need to question, you need to give the information so that that referral is given to the right direction. And there's lots of other updates on the Department of Health website. Most of the numbers are there. And let's move to the next one. And there's also other databases online as well that also list some of the mental health providers of color that we have, where you can go in and just skim through and see their bios and what their focus is for you to know if to be able to identify who you would want to connect with. But overall, we really need to pay attention to our bodies, how we are responding to the current pandemic. Everyone is going through something. We are trying to create meaning to this pandemic. We are creating a new normal, which we may never go back to the way things were, but we can still thrive with what we are going through and be able to really generate some positive outcomes. So we'll continue on this discussion as we continue looking into mental health and other diagnoses and what does that look like in a treatment setting. And with that, Judy will pick up from there and take us through some of what the treatment settings are doing to address mental illness amidst the current situation, and addressing also communities of color and African immigrants like us. Thank you for the time. Judy, you can pick up from there.
Thank you so much, Nelly, for a wonderful presentation, and I really want to thank you so much for all you are doing for us at the state level. It's always nice to know that we have someone that is actually also understands the struggles that we go through and trying to help us mitigate all the problems and the things that we are experiencing. And so I would like to say that COVID-19 has become a storm that affected each one of us, whether rich, poor, young, old. Everybody was destabilized in one way or another. And in that storm, I've been looking at it as if, as a big storm, when it comes, we're going to find people who have ships, people who have boats. Others might just have a life jacket, or others may just be on just a log that is just floating on the water as the storm goes by. And I wanted to mention that we are all in this storm. It's just that maybe we might be in different boats or different ships or, voyages. But, it's always okay to reach out to somebody and say, hey, I'm drowning, because we all experiencing this. So let's move on to the next slide, please. So I will give a little bit of information about my background. So I grew up in Kenya, moved here many years ago, and when I moved here, I got into the medical field and initially working as a nursing assistant, so seeing patients who were struggling with mental health problems. And when I came here, I found out the culture was very different from the culture that I grew up in. Remember growing up in Kenya, there was a lot of stigma. Even here in the US, actually, there's still a lot of stigma and a lot of things that are still, needs to be addressed. But I remember specifically that if I have to provide any kind of care, then I needed to recognize my biasness. I needed to recognize what do I know about mental health first so that I can be able to understand a different culture. So in Kenya, when I grew up in the village and somebody had a mental health illness, most people used to think maybe it's because of witchcraft or some spiritual problems, and it caused such a stigma that which has caused many people to suffer in silence. And there was some kind of fear around the person, and people didn't really understand it so well. And as you know, there was one hospital in Mathare, or that was in Nairobi. That was the only psychiatric hospital that was there the time I was there. And I remember, patients will try to run away from there because of the deplorable conditions that were there. So over time, we are trying to understand the disease. And just like Sister Nelly was explaining, that it's not any different from, physical illnesses, or diabetes. It is also a disease that needs to be treated. So thank you so much for taking a stand against stigma, because if you do that, then we are able to help people that are suffering in silence. Next slide, please. So what did I find out? I actually found out that mental illness and or disorders, we call it, is actually a real thing. So people, never used to understand it. People will think, oh, I remember over a certain thing that somebody will say, like, oh, this person, their book was stolen, and somebody, bewitched the person. Or you could hear something like, allow me to direct translate to this, that says, oh, so and so's daughter, his brain or her brain has been scooped, like there's a few scoops of spoons that has been taken out. So it just made it very difficult to understand, is that a real thing? Is it a disease? What is it? So we found out that most researchers believe that mental illness occurs as a result of chemical imbalance in the brain, but that's not actually all. It also can be caused by the mood regulations and faulty mood regulations in the brain. There's some genetic component, or some people that have the propensity to get the disease. Also, the stressful life events. If you grew up in a place where we had adversities after adversities, you always gonna be stressed, and the stress has also caused a lot of people to get into the verge of getting that mental health problems. Medication, some people have to take medications for their medical problems that also in return can cause that kind of side effects. We also have a lot of medical problems, especially the one that deal with the hormonal, the endocrinology part of the body that we see, but to name but a few. These are many. I only have about 30 minutes, so I can't be able to give you a whole spiel of everything that I've been able to know. So human beings have like millions or billions of chemical reactions that make up the system that respond to your mood, how you perceive things or how you see things. Are you looking at the glass half empty or half full? When you get an experience in life, like you get a lemon, do you use the lemon to make a lemonade, or do you change it to make it a million? So this is the ways that we have to now to understand that if our your mental health is not as in healthy condition, that you can be able to look at those things differently. So we've been able to magnify a lot of these things and understand them. Next slide, please. So, with COVID-19, and I was saying as the storm which we are actually experiencing, I remember initially when it started around in March, and it was such a frightening moment. And as a person who works in the medical field, I was actually scared myself that, if I have to work, what if I never come home? And, for to our loved ones. And when I work in a hospital setting where we'll see a lot of patients who will come into the ICUs, and we have to see and touch death almost each day. So this was very frightening, I have to be very honest. And as providers, a lot of us actually underwent some stress, and we had to get the help we needed to be able to continue providing to the care to the loved ones. There were days that you just had to go to a room and actually cry before you go see another patient. So we saw a lot of, I mean, initially in around March, our ERs were completely empty, and then we were like, where are our mental health patients going? Mental health patients who have disorders going. We are not seeing them. Are they okay? So we were actually concerned, and as we went into March, April, May, June, we started seeing now people were now trying to understand the COVID-19, and now were able to come in, and we started seeing the patients. Now we started seeing a lot of patients with their anxiety, depression, schizophrenia, PTSD, and many other disorders. Substance abuse actually went up with alcohol and illicit drugs as well. We have had a lot of overdoses as well, and as you can tell if you've been following the news, that we've had actually more cases of overdose again of opioids in this period of time. And a lot of information we'll find out if was it related to the stress and all that. So we are still seeing people now, especially in the hospitals and also in the clinic. And I so appreciate so much that they have been able to liberalize some of the insurances, and we are seeing more people now. So initially, some of the services were interrupted. Most places are now offering the services. And when you look at Hennepin County in Minnesota, which we have about 13% of African American people or African descent people living there, when I looked at last time at their website, they are not doing face-to-face. However, they are taking phone calls. They're doing the telehealth. And you can call a number. The number is 612-596-9438 if you ever needed the help. They do offer 24/7 care to people that are struggling with any kind of mental health illness or disorder. And they also have some of the clinics that offer culturally competent health. One of them including the North Point Health and Wellness in the Hennepin County. You can actually Google Hennepin.us, and you can be able to see, especially if you live in the Hennepin County, they do have a lot of resources there. So they do accept a lot of insurances. They do sliding fee for private pay as well, and they have an help crisis for 3 to 10 days that can help to stabilize the crisis as well. So for members that live in the Hennepin County, again, I'm just going to say, go ahead, look at their website. They do a lot of cares for people who are struggling, and don't, wait and suffer alone. There's a lot of things that can be offered out there. Unlike other parts where we have lived and there wasn't help, or there was a lot of stigma, there's help here. So get the help when you can. So what do we know about the World Health Organization? It reported that by far the largest public health mental health impact has been in the form of stress and anxiety, and it actually predicts a rise in depression, suicide, and substance abuse. So we are hoping that we are a nation of hope. The vaccine actually came out, and I have to say I was one of the people to get it first, and I'm glad that research has been able to help us to mitigate some of these problems. So according to the most recent According to a recently developed emotional epidemic curve without adequate mitigation measures, countries will experience a lot more of negative mental health consequences. In fact, can you please go back to the previous slide? I was able to see that even in Kenya and other African countries, they are requesting them to start do more things for mental health so that we can prepare in case we have to see more patients. And if you've been following the news in Kenya, they actually decided to make Mathare now a state hospital, and we are hoping that they can be able to help also people back in Kenya, for those of you who have loved ones and that has been a stress for you. Can I please see the previous slide, if I may? Yeah, so we also see, there's gonna be anxiety in the first, because people are gonna be anxious. There's depression. People have lost jobs. People are not able. They are home with their children. A lot of people do not have the child care services so that they can go back to work, and all those many things which are the anxiety. And also we are seeing the second peak, which after now later on, after when there's a time we actually had very minimal numbers, and now then we started having higher and higher numbers. Now we are seeing more of the people that need help, for sure, especially the depression, suicide. And it, in almost every day I see a patient with who are struggling with the depression, suicide, and we have to give that compassionate care. I know that let them know that they are not alone, and we are not any immune. Most of us who also are in these fields have been in the same shoes before, and we have to share what we have used to help us get through the valley of struggle. Next slide, please. So the next slide is going to talk about what does the hospitals and many of these clinical settings do. Next slide, please. We have been able to have good research and some great imaging that are helping us to understand the mental health illness and disorders. Like I told you, most people are thinking that this could have been maybe somebody who is not spiritually connected, or somebody who has been bewitched by some witchcraft person or something. But now this sophisticated kind of imaging, like the PET scan, the fMRI, which is like a functional MRIs, and all these are able to show us the regions of the brain which is being affected when you have the depression. So as somebody was saying that somebody's daughter who her brain has been scooped or something, actually they had an idea there. It's a disease that actually affects an illness that actually affects the brain. So now the imaging are showing how the brain actually looks like. And because of this great kind of imaging and other things the research is bringing, we are now more than ever been able to know about how does the brain regulate the mood. We're understanding the biology of the mental health illness, and really, I have to say, we are not anywhere we are not done yet. There's a lot to learn, and each day we have to learn. I learn each day, so you can't stop learning. So we have to learn each day. So, and there's a lot of researches now because of this imaging and the imaging that is coming out. Now we are able to get medications that can actually be able to trying to work. A lot of medication in the clinical trial that can be able to act almost right away, because most of the medications that we use right now, you probably get the relief, maybe start feeling a little better after 2 weeks or so. And sometimes, as it is a very challenging. We have to use many forms of treatment in order to get somebody stabilized. So let's go to the next slide, please. So yes, I'm sorry I have to take you back to your anatomy class, or just give you a little bit of an overview of the brain, because to me this is so fascinating, because helps us to understand actually which part of the brain is affected. And as you have the brain there, which they say it's about 20% of your body, and it's about 60% of the fat, a brain. So you need to eat some nuts, you need to do a lot of healthy stuff to help your brain grow. So we know, if you look on that screen there's an area called the amygdala. So excuse my pronunciations. And this is the part where we actually experience the sadness, the anger. And it's a normal part God puts for us there so that we can experience that. For most of us who come from Africa, when a loved one has died, we cry, we scream, we wail. That is how we express our sadness. And if we have to do that, there's nothing wrong doing that. So But they have noticed, like, if you have depression, that part has a lot more activity. In other words, that, the person who has depression continues on that part of the brain to continue having high activities. Because if you have you have a good mental health, if your loved one passed on, you go through a phase of grief. So, you cry today, you cry some days, but then you get better. Then tomorrow, if you know that, it's well with my soul, and then you move on. However, the person with the depression, even after recovery, they continue having that higher levels of activities in that area of the brain. They also, there's a part there also called the thalamus, which also, the thalamus is the part that where we use our high function level, like the speech, the behavior, where we learn things. And that's the area which people are saying, the researchers are showing that most of the patients who have bipolar problems get the area affected. And so when we are using the medications, we are trying to find out, if you get diagnosed with bipolar, we are trying to find out, how can we get a medication that actually can act that part of the brain. So, and then there is also another area there called the hippocampus. If you can see it, it's the one that almost is in between the thalamus and the amygdala. So that area there is an area that actually registers information. So there's a saying in Africa that says, a saying that says, once bitten, twice shy. This is an area that always reminds us what we have gone through and how we can get out of there. So you find out that that's the area that registers. So, like, let's say, if, for instance, today I'm so low and I'm able to get out of that situation tomorrow, my brain is able to remember that and tell me, hey, Judith, yesterday you felt like this, you cried, and everything went well. Today you were able to wake up. The people who have depression seem to have a smaller part of the hippocampus there, so that it's kind of depressed in a way. So some days they are not able to, their brain is not able to tell them, like, you were able to get out of this difficulty situation here, so now you can be able to do that. So this is not something that these people are making up, like somebody who is having mental health problems is making up. No, it is actually an illness that is affecting them, and they want to be known as normal. They want to be told they are matter, they are loved. In fact, they are loving people. And many a times we don't want, because of the stigma, we don't see through that. So let's go to the next part of there. Yeah. So, like I was saying, I think the researcher shows that hippocampus is smaller in depressed people. They did a study there, and that was in the Journal of the Neuroscience, whereby they found out that most of the women who were depressed had about 9 to 13% of the hippocampus was smaller. And they also say the more and more you get depressed, the more and more you make that area become so small. There's also another area which I wasn't able to get into. It's also a lot of science, where we talk about the neurons, and these are the ones that stress plays a role in depression, and a key factor here. So most of the experts believe that stress can suppress the production of the new neurons and in that hippocampus area. So most of the medications that we use actually are supposed to help you regrow those neurons. So if you get the medication today and you're told, please take it daily, and then you stop taking, it's not unusual that you will find out that you're probably going to relapse and get back to the depression, because you have not been able to take it for long enough for you to start regrowing that area. And many times, sometimes it's also not just medications alone. There's a lot more things that you have to do in combination to that. So let's go to the next slide, please. That is, I already talked about that. Please, let's see another one. Sorry, I might have duplicated that when I was doing that. So how do we treat mental health illness or disorders? The treatment actually varies. We do use a lot of we do use psychiatric medication, and we do know that they do not actually cure the mental illness. What they do is they improve the symptoms. I remember when I was seeing some patients with diabetes, and we will work about and say, hey, we are going to change your diet, please, exercise and all that. And when they'll do that, their numbers will improve immensely, and they'll come back and say, okay, now am I diabetic free? And we tell them no, because once you've had that, we have to continue monitoring you, because the body, if it's the pancreas that was having some problem, it might do that again in the future. So we have to continually, evaluate you. So that's the same thing, there are days you're going to have some good days, some bad days. Even when you have the medication, you don't take it once and think you're cured. No, you have to continually be in contact with your loved one, your providers, and the people around that are going to notice, like, hey, Judith is not feeling well, something is off, and call the help for you. So we do have a lot of medications and a lot of therapies, the psychotherapy, and sometimes the medication used along the psychotherapy, and also the prayer or connecting to nature, and all that helps all these medications work well. So in a nutshell, the best medication for you can depend on a particular situation and how your body responds to the medication. In fact, one thing I want to tell most of us Africans, or or people of descent, find out about your family members, like what are they taking. Feel free to communicate about these things. There's a time I saw one of the patients with mental illness, and she came to me and she said, hey, my mom was struggling with the depression, and this is the medication she was actually using. And because she offered that medication, we looked around and we found out that she would actually be a good candidate for the medication, and that actually helped her a lot. So when you are able to know some of the information, find out from your grandparents, what is it about my family history that I can take. And when you go to you're coming to see providers like us, offer us all the information, tell us what we don't know much, we are depending on you to give us the information to help you. So feel free, open up, let us help you as you help us as well. So next slide, please. Next slide, thank you. So what should we do? Like physical health, we can benefit from looking after our mental health, and Sister Nelly went through a lot of that. So I would probably just kind of, move really quickly there to save time there. So, everyone can benefit, whether you have a mental health problem or not, or illness or not. You can benefit by really engaging your mind in a better way. I've always come from a background, because I'm a family provider who believes in preventative if I can, but we always know most of the time we don't always prevent things. Some days, we have no control over things, but if you're able to control certain things, you're in a better position to be well. So some of the things I'm going to mention were developed by the New Economics Foundation in the UK. So can we move to the next slide? I'll move really quickly on these ones, because it's more, what we can do. You can connect, you can give your time, words, and presence, take note, take notice, keep learning, be active. Next slide, please. Yeah, so like I say, don't be a rumor monger. Please, can you go back? Thank you. Yeah, don't be a rumor monger. There's a lot of news that out here is fake news or bad news that actually does not help anybody. Especially if we have people who are struggling with mental health, the one thing you don't want to do is add a lot more things that are actually bombarding their mind. If you are in these WhatsApp groups or some Telegram or something, please do not be forwarding things that you don't know if they are real or not. Take time, read, carry out the act of kindness, be fair. In this world, everybody has a struggle, a journey. And so the one thing you can do is be kind. If you can choose anything, be kind to one another. You don't know what kind of struggles people are going through. Be sensitive to your words. And when we talk about give, some people just think it's about money. No, it's not about that. Just be a friend that calls and find out, hey, Judy, I haven't seen you post on WhatsApp. Are you okay? Be that vigilant, be curious. Thank someone when you meet somebody. Carry them their groceries. The little acts of kindness actually go a long way. So can we go to the next slide? And that is not just for the patients alone, but also for you as a person. So while wearing masks, and again, those people who are going to tell you, please continue doing, what you can to protect you and others as well. Pay attention to the present moment. Look at your thoughts. Always find out, am I angry at this time? Should I respond to this person or not? Take time before you respond. And if take look at around the world and what's going on. This can also actually help you boost your mental well-being. Reflect on your experiences, which can help you appreciate what matters to you. One thing I've always known is, even these the people like Isaac Newton, the icon people that have always struggled with depression and other mental illness, including Abraham Lincoln and many other people. If you've read the history, you can tell, they had to have a purpose. They have to wake up every day and say, I have a purpose. So find your why. Why do you have to wake up every day? Take notice. Remember the simple things that give you joy. Try. I know it's very difficult for you to, but take a step and try and remember. Recollect the memory and it will help you. So be curious, notice the change of seasons. We have snow out there. Open the window, just look outside. You might see actually something on that tree that you've not seen before. So each day is going to give you something. So let's go to the next slide. While observing social distancing, try to continue to build connection with colleagues and friends and other people that can enrich you every day. I tell people, stay away from people who are toxic. You do not have to be with people who are toxic, especially if you're struggling with mental health and disorders. Cut them, until you are better. If they are putting so much pressure on you, it's okay to take care of you first. Build the support and network that helps you get, through the tough time. Connect with some neighbors, people at work. Again, I know this is a difficult time for us to do that, but we're able to meet each other on Zoom and Google Hangout. There's a lot of virtual ways for us to connect. And Manyagetinge, as we know, is been some days I'm a member of that, and I see people post every day. Some days I smile about it, and some days, it gives me a challenge. I might be the ones who are either observing or commenting. No matter what your position is in that social group, just be there. And if it becomes too much for you, you can turn it off for a little bit and get help, rest and then get back on it. But you need to be connected with everybody else because, hey, iron sharpens iron. If you're just going to stay alone, you're going to just feel lonely more and more. So let's go to another slide. And the other one, churches are also great places to be able to share your, a lot of us who come from Africa, we depend on our church as a family because our families are sometimes too far away from us. So when we are away home, away from home, connect with the people that are around you. Don't stop learning. Yeah, each day you're going to learn something. So enjoy things. There's nothing that is impossible for our mind to do. Some days what I tell most of my patients is find something to do. You can do coloring. You can start doing, yarning if you have a crochet or something. Work on something. Learn something, especially with this, COVID-19, when most of us are not able to work and maybe you have 15 days to be at home or quarantine by yourself and there's nobody there. Learn a new recipe and share it with somebody. So embrace new experiences, see opportunities, surprise yourself. There are people who have said, oh, this COVID-19 really has brought some blessing in a disguised time. So look for an opportunity even in the dark, gloomy times. They're always there. There's a light at that end of the tunnel, and go and turn on that light at the end of the tunnel. So my closing remarks here is during the storm, it's possible that you may feel actually very unsteady, and you can feel like, oh, am I alone? Can I have somebody to just touch my hand and even talk to me and even tell me it's okay? I just want somebody to tell me I matter. Somebody that wants to tell me, you had a long day at work. How about, how are you doing today? It's never about me. You or up, even some days when I'm very low, I call somebody, and by encouraging them, actually, I encourage myself. So I would like to assure you that each one of us are very strong. Try your strength. God has given each one of us some strengths, like a wire cable that sways in the storms. We have to hold fast, hold firmly. Find out where's your anchor. If you are a person of faith, have your faith foundation in a person that that is not going to fail you. And so whatever ship or boat that you are in, the rough waters can be very strong, the waves. And I know most of the people, it was just about Christmas, you had to wave your money back to Kenya, and I'm sure those tides were very strong with the wave, and you probably look at your account later on, you're like, oh, how am I even gonna, you had to satisfy other people's need first. But hey, look here, just remember that you are not the captain of that ship, but you're merely a subject of a divine force. So whoever created you has a greater purpose in your life, and you have to find out what is that purpose that you have for me. So each day is going to be difficult and comes with adversities, but most of the people have resilience and will find out how can I do. If not, seek the help. Like I said, Hennepin County members and people who live in that county, look up on their website great resources that they have. And if you ever want to reach out to you, and like you said, they don't even have to be providers or anybody, just reach out to somebody, whoever you feel a connection with. And with that, I say thank you so much for listening, and reach out whenever you can. You're not in this journey. Don't cross the Jordan alone. We can cross it together. Thank you.
Very, 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 I don't know how to finish, very scintillating or whichever way actually you can put it. Okay, let's now speak proper English. I mean, the presentation by our two ladies, very nice, very encouraging, very educative. We are not done yet, our viewers. And for anyone who has a question, please use the hashtag KDRTV Live so that your questions can be answered by our learned ladies who are still continuing to do a presentation. So the next section, we are going to have Ngozi Akubuike to come and actually do a presentation on domestic violence. She has actually clearly told the viewers earlier on that she is a survivor of domestic violence. So she really understands this thing very well than most of us. And she has decided to come forward and actually share with us a vast knowledge on how to prevent domestic violence and what needs to be done if you are a victim, or you might be thinking that somebody is actually abusing you in your relationship or in your home or in a family. So Ngozi, it's now your time. But before that, I mean, after she finishes her presentation, viewers will have an opportunity to ask questions. You don't actually need to wait. Just go to KDR TV #live and ask your question, or put your comments on Facebook and on YouTube and on Twitter. So after Ngozi's presentation, all the panelists will have a few minutes to address your questions. So don't go away, don't step away before Ngozi finishes her presentation. Then later on, you can actually be able, if you want to call in by a live TV show, we are actually able to give you an opportunity also to do a live in, or you can actually tag your question on our stream. You can also just call in live. If you want your face to be seen, we have the technology. It's very possible for us actually to bring you or to route you in so that you can ask your questions to the presenters. So this particular time, we sit back and watch our beautiful lady, Ngozi Akubuike, to continue with the presentation. Thank you very much, viewers, and stay tuned to KDR TV Live. Ngozi, it's your turn now. Go ahead, my dear sister.
Thank you so much, our able moderator. I am so grateful to Nwayatinge community for broaching these topics, and that most of the time we in Africa we shy away from. I am glad the process of preventing has started with creating the awareness, both on mental health and on domestic violence. I am so appreciative of my co-presenters, Nelly and Dr. Judy. What an awesome job you guys did. these two topics are topics that are so dear to me. So let's get on to domestic violence. Can we have the next slide, please? Next slide. Today we would like to learn about what domestic violence is about. At times we call it domestic abuse. And by learning that, we will intend to create awareness. We want to see what our belief system is. Our cultural beliefs, our religious beliefs, the things that comes to our mind when we think about domestic abuse. We look at the myth around domestic violence. We also examine the science and look at resources that are available. There are resources available for every victim of domestic violence. Can we have the next slide, please? We have a both legal definition and the definition for a layman when it comes to domestic violence. At times, domestic violence is known as domestic abuse. At times, it's known as domestic violence. It's known as partner violence or partner abuse. We'll examine the legal and then look at what in the common parlance, what domestic violence means. Next slide, please. Minnesota actually has a definition in the statute for what domestic abuse or domestic violence is. Minnesota defines it as refers to it as domestic abuse. And it always, whenever it's domestic abuse, it involves a family member. It involves someone in a household who is either perpetuating physical harm or bodily injury on another family member, or who is causing another family member to be afraid that something bad may happen to them. It may include threats, different kinds of threats. I will divorce you. I will kill your parents. You know, all of the threats are just things to make someone afraid at the moment in time. Can we have the next slide, please? These are the terminologies that we use when we talk about domestic violence. We talk about victim. Victims are the people who have been abused, and at times we call them the abused. Some people do not want to address themselves as or be known as victims because they believe that they have moved from the area of victimization to actually thriving. And so they prefer to refer to themselves as survivors. The person that abuses is called either the abuser or the perpetrator. Please, next slide. As we have said earlier, domestic violence it involves intimate relationship, family members. Ironically, it has to do with love relationship. And love relationship is a place where you shouldn't have violence. Love and violence, they do not work together. However, when it comes to domestic violence, we find that it is in the love relationship, that's where you find domestic violence. You find the abuser using fear, using shame, intimidation, and it continues. It's a constant thing that is done to wear the abuse down. Most of the time, we find that it starts with words. And from words, verbal abuse, it moves on to the physical acts of violence. In all these things, our main purpose is to let us know that abuse is never okay. Under no circumstance should we excuse abuse in any relationship. Next slide, please. I want to challenge us on our perceptions about domestic violence. What comes to mind when we talk about domestic violence? If this were to be in a location where we meet, we would have generated some comments from individuals to talk about what they perceive domestic violence to be. And these, our perception are always built around our belief systems, our ideas, where we come from. And as we know, Africans, we grew up in society where men dominate what happens in the society. There are usually gender role and roles for men and roles for women. And that's our perception. When we look at domestic violence for us Africans, immediately we talk about domestic violence, we are thinking about, oh, divorce. We are thinking about family. At times we think about family separation. At times we are thinking about failure. Most of the time it's usually the victim that thinks about, oh, I have failed in the marriage. If I did what I'm supposed to do, we wouldn't get to this point in time. We have these cultural beliefs, the stigma and shame that is associated with it, the fear of revealing embarrassing situation and humiliating details about relationships. And we're also sensitive to judgment. We, as Africans, we are communal in nature. We relate, we are social, we relate with people, and we care about what other people think about us. And so some of these things come to bear. What will other people think? Would people even believe me? And at times we rationalize the abuse and say, oh, well, he is a good parent, she is a good parent. That is more important than disclosing any abuse that is going on. We have our myths about abuse, domestic violence, and domestic abuse. We think that domestic abuse only occurs in people who are not educated. But unfortunately, domestic abuse cuts across every socio-economic background. It can happen. It's an equal opportunity agent. It can happen to anyone. At times we think that it's not a problem in our society and we think that because people are ashamed to talk about abuse. People are not confident to talk about abuse. We think that men are always the abusers, and that is not true. Yes, the statistics show that men more abuse the women, but it's not in all cases that women are the victims of domestic abuse. We think about domestic violence as only being physical. But mental abuse, psychological abuse is even at times worse, has worse effect on individuals. And that's where the mental health issue comes in. It can result in somebody having a mental health issue. We think that the victims are weak. Oh, why couldn't she just leave? Why couldn't he just leave the relationship? All they needed to do is to get up and leave, especially when we live in a society like America. We think that the person, a woman, has a right to leave. But it's not like that. And at times we think that abusers are only abusing because they are drunk. Oh, well, he did that when he was drunk. If he wasn't drunk, or if she wasn't drunk, he wouldn't have done that. When we look at domestic violence, we find out that African Americans have the highest number of reports reports about domestic violence. 1 in 4 women and 1 in 9 men among the African American, they report abuse. 1 in 7 women and 1 in 25 men have been injured. I am sure we have learned stories of the abuse even among Africans happening in America here. Women have been killed. A lot of them have been killed because of domestic violence. And it's because it had gone on so long, before it progressed to the extent of their killing or shooting their spouse. So many things have gone. But because we live in a society where we care so much, the way we were raised as women, we were raised that the responsibility of keeping the home rests on the shoulder of the woman. And as such, most of the time you see women suffering abuse and not speaking about it. They are enduring in silence because our mothers have trained us that we need patience in marriage to make marriage work. And so we have carried it on even at the risk of our lives. The statistics reveal that 20 Americans suffer domestic violence every minute of the day. What are the types of domestic violence that we have? We have physical, and this involves pushing, shoving, slapping, choking, throwing things, physically restraining one. Reckless driving, when someone is driving recklessly in a car with the spouse only to inflict fear on the individual. And that also can be emotional abuse and psychological, because it will have a psychological effect on the individual in the vehicle if someone is driving recklessly. Psychological or emotional abuse is one that is so difficult because it can be so subtle. It's hard to recognize it, just like mental health. Because it's not physical, it's not something that we can see, it's difficult for us to recognize it. But it's always aimed at chipping away the confidence of the victim. The victim finds themselves walking on eggshell so as not to offend the abuser. It involves neglect, rejection, isolation, excessive criticism. It's like the person who will never do anything good in the sight of the abuser. Or excessive demands, ignoring or threatening the abused. And some of the threats, some of these things, some people who abuse don't even know that they are engaged in emotional or psychological abuse. Like in some relationship, you see some spouse always threatening to divorce. I'm going to file a divorce. I will divorce you. I will divorce you, And most people don't even realize. They say that they don't even realize that they are engaged in emotional abuse, because most of the time people think that abuse can only be physical. We have sexual abuse, and one will say, I have had so many people say, how can a man rape his wife? Rape cannot occur in a marriage. Yes, rape occurs in marriage. And when that occurs, that's sexual abuse. When you engage in non-consensual sex or ask your partner to engage in sexual acts that they are uncomfortable with. Or at times when you deny a partner sex or put a condition, unless you do this. If you do this, then we can have sex. There's also the cultural aspect of domestic violence, and this is not allowing an individual to identify with the culture that they come from. It could be criticizing the form of dressing or the language or the diet of the individual. Or at times you find some people who are, these are people who marry across culture, that speak different languages. And when they know the person that doesn't speak the same languages with them, they engage in their own, in a language that they alone can understand, thereby isolating the victim. Can we go back to the previous slide, please? We have financial and economic abuse. And this is where a partner controls the income and wouldn't allow the partner to have access to the family's income, or keep financial details of the family away from the other partner. At times, they will not allow the partner to work or make gainful employment or engage in gainful employment. You see some also not allowing the partner to further their education that will enable them to have a marketing power in the society. We have digital abuse, and this is where some people control what their spouses or their partner do on social media. I've had instances where people go and hack, or they go into their spouse's Facebook account, change the Facebook account in order to read and find out who is communicating with the spouse on Facebook. Next slide, please. This is just a demonstration of just a summary of what abuse, domestic violence is. It's about power, it's about control. It's about the abuser exerting or wanting to control whatever happens in a relationship. They want to be in control. And in order to do that, they use coercion, they threaten. In fact, at times, some people threaten to commit suicide, and that's a way to control their spouse. They threaten to report the spouse to immigration or welfare. Or at times, you find them involving their partner in illegal activities. I had a case where a spouse forced their partner to engage in illegal activity. And when the consequences came, it was the partner that suffered the consequence, because his fingerprints were never found on the illegal activity. And some people may wonder and said, why would someone be so foolish enough to allow themselves to do that? That's to show you the extent of power and control an abuser can have on the victim. They use intimidation, either through looks, or at times you see them destroying things or destroying the victim's property. They use emotional means, putting the victim down, maybe comparing the victim to another individual, calling the person names, making the victim think that they are crazy. Using mind games, making the victim feel guilty. At times you hear these words, "See what you made me do." Isolation is used to control the individual, control who their friends are, who they could talk to, what they could wear. They limit their outside involvement. And at times they use jealous. Oh, I am so jealous. I so love you that I am jealous. I don't want people to take you from me. I had a case of a woman that actually thought that the husband loved her so much that he would be the one to drive her to wheresoever she goes. He refused that she will go to further her education. He will not allow her to interact with the outside people. She even didn't know that there's something called tax return. For years, she lived in United States for years, she never knew anything about their finances. Her health care insurance, she didn't have access to the card. Her passport, she didn't have access to. None of the documents that belongs to her, she did not have access to any of the documents that belongs to her. And she felt it was love. This man loves me so much that he is doing all this. He's caring for me. And all these things that are going on, at times it progresses from these subtle behaviors, subtle acts, to physical violence. And even after the physical violence, hitting, at times strangling, the abuser will always explain it away, or at times blame the victim. See what you made me do. If you didn't do this, I wouldn't have done that. You provoked me. And at times they try to minimize what they have done. And the next thing you see is they're bringing flowers. I love you. Please forgive me. It will not happen again. At times you see them using the children. Some have threatened to take away the children from the woman and telling the woman that she is a bad parent. Effects of domestic violence. It has physical, like we have discussed, physical injury. There are emotional scars that could result in mental health issues. There are social issues associated with with domestic violence. People withdrawing from the society, especially when they have evidence, physical evidence of the abuse. You see them either wearing some things. In summer, you see them wearing long shirts in order to cover that. Domestic violence affects the family unit. And this is an area that is of concern. We are built in a way that there should be both parents in a family unit. But most of the time, domestic violence results in the breaking of the family unit. And it's mostly for this reason that most African women remain in abusive relationships. Because they are thinking beyond themselves. They are thinking about the children. They are thinking of keeping that family unit cohesive, keeping it in place. But the danger is if there is domestic violence in a family unit and there are children in that family unit, you see the children learning, thinking that that is the way family units should be. You find them learning. There was a time a video was passed around about a child beating, or somebody told me a story of a child beating the sibling and said, that is how my dad does to my mom. You can imagine the damage that has done to that child. It will take years to retrain that child, for that child to relearn that that's not the appropriate way to treat a woman. Next slide, please. We've talked about this, effects of domestic violence. Please, can we go back to the slides? Go back, some slides back. Back, please. Back, please. Back, please. These are some of the effects of domestic violence, and some of them are tied to mental health issues, injuries, digestive issues. These are some of the things I have noticed from women who have suffered domestic violence. Some become ill for no reason. They'll go to the doctor and they wouldn't find anything. They experience chronic pain. Some have digestive issues, low self-esteem. They at times most of the time feel that they are not worth anything. They are ashamed. They feel shame. They have distorted thoughts about themselves. There is an emptiness. And in fact, at times you find them taking risky actions. They avoid people because they don't want you to know what's going on. And like we have said, it affects children. And when family unity is broken, it also affects the financial stability of the family. Next slide, please. What are the warning signs? What do we have to look out for? This is not to say that it's all inclusive. These are not all the warning signs, but they are pointers to our knowing that there exists domestic violence in a relationship. When someone is over-possessive, control what the person wears, control what they eat, control everything about them, who they should see, where they should go, and when they should go out. When people are extremely jealous, every attempt of the victim to improve themselves are sabotaged. When people have dogmatic belief about gender roles, and this is peculiar to us. We have our belief system on what a woman should do and a man should do. And some people actually take it to the extreme. There was I had a case where in a culture, it's part of the culture for the woman to kneel down to serve the man. And problem came because the woman did not kneel down to serve the man food. The next time the woman was locked out of the house in deep winter, she slept in the car. This happened in Minnesota. We have some controlling behaviors, like one decided not to sleep, would not sleep. The wife had to stay by his side so that he would be sure that the woman was not communicating with anybody he didn't want her to communicate with. He opened his eye at one point while sleeping and didn't see the woman, and that was trouble for the woman. There was a case of a woman had a date. Every Monday, the husband would beat her up. That's her date. Like couples have their dates, that was his own date for the woman. Every Monday, he would beat her up. That's a controlling behavior. Blaming the victim for anything that goes wrong in the house. At times, they're accusing the victim of having an affair, humiliating the victim in the presence of others. And all these are ways of exerting control over the woman. Next slide, please. These are the things that we should watch out for in our interaction with people. Are they withdrawing from the things that they normally do? Are they not willing to be around people? When we have meetings, now that we have meetings by Zoom, are they calling in for the meetings? If you see them outside, what type of clothing do they have? Are the clothing appropriate for the season? Or is it an attempt to cover some bruises that they have? Do they have limited access to money? anytime you have to do something and they'll tell you, oh, please, I will first of all ask my husband, or I will ask my husband for money. Do they suddenly change? Like somebody who is an extrovert, and by the time you know it, the person is an introvert, doesn't want to interact with people. Some of these warning signs also relate to mental health issues. And that's why I feel that domestic violence and mental health, they are somehow interconnected. Next slide, please. Next slide, please. People always ask this question, why do victims stay? I had someone who is knowledgeable, a counselor, and she made a statement, said, if you're an abused person and you stay in a relationship, you are enabling the abuser. And I said to myself, you don't know what abuse can do to someone. Abuse is like indoctrination, where someone is told over and over again the same thing, that they are worthless, that they don't know anything. A person is demeaned to the point that at one point they will start believing the things that they are told. People stay for different reasons. Societal expectation that somebody remains in marriage could cause someone to continue to stay, at times to their death. Fear of the unknown. What's going to happen outside? I don't know. This is the only place I know. This is the only man I know. This is the only family I have come to know, especially in this country and in this COVID period. It may be difficult for someone to even think of. Next, the slide we're talking about, please. The previous slide, please. Previous slide, please. Some have seen domestic violence to be normal. It's the normal way of life. That's the way my parents lived. My father was domineering. And so in our society, men should be domineering. And so that's the way of life. That's the portion of women. And as a result, they stay. Some because they love. We can't discount the love issue. People actually stay because they love the abuser. And it takes a while. Most Africans, they marry. They really marry because they really want to get married and stay in marriage. And it's always till death do us part. And so it may sound strange, but people actually stay in abusive relationship because of love. People stay because of immigration issue. Maybe they are relying on their spouse to file for them, and they have delayed so much. People stay because they have no other resource, no finance, because the man had been controlling all along, controlled the finances, and that they didn't have any financial ability to step out and stay on their own. Next slide, please. What do we do when we know that we're in an abusive relationship? We can call for help. There are help available. In Minnesota, we have a Minnesota line, day one, and the number is 1-866-233-1111. I repeat again, 866-233-1111. If you know that you're in immediate danger, please call 911. That is your first call for help. And we have a nonprofit called Haven, and the number is 651-321-3360. 651-321-3360. like our sister said and quoted Nelson Mandela, when you call the 651-321-3360, you will be in contact with someone who knows, who has been through the process. And when you speak to someone who understands your language, then you'll be comfortable. The safety plans that you may have in place depends on the level of danger that you are in. But some of the basic things that you need to know is you need to know your escape route. When you recognize that you are in an abusive relationship, you need to plan your escape route. Make sure you have a bag packed that have the bag must contain your documents, the relevant documents that you need. You need to also make plans of where to go if you need to go. Have a code word that you can give to your family members or friends. Once you give them that code word, they will know that you are in danger. At times, you may need an attorney to help you walk through the order of protection and other legal issues. The thing is that with the order for protection, it doesn't guarantee your safety. The only thing it can do is to make sure that the abuser doesn't contact you. And if he or she dares contact you, they'll run afoul of the law and they will be arrested by the police. Next slide, please. In COVID, it has become more challenging. We are indoors, we don't see people, we don't interact with people. UN has labeled domestic violence as shadowed pandemic. It's a pandemic within pandemic. Because people may not know who to talk to. They are not interacting with people outside. They are not going to church. So nobody knows what is going on. Everyone is within the household. This domestic violence pandemic causes stress as well. And isolation can be dangerous in these situations because people do not know what is going on. And at times, living can be very complicated. There may be legal issues involved with living. There may be housing issues, the fear of the unknown, all those issues. How would the society react to my living? Or in some cases, the people may not even know anyone at all. And the victims find that it's very complicated. It might be even better for them to remain in an abusive relationship. But I want people to know, if you're in an abusive relationship, don't be afraid to come out. Don't be afraid to speak up. Staying in an abusive relationship is dangerous. Not only for your physical health, it's also dangerous for your mental health. It's dangerous for the children in the home. That is not a legacy we want to leave for our children. Love is beautiful. Love is not abusive. When it gets abusive, please seek help. It's not a time to keep it within the home. Keeping it within the home is very dangerous. Next slide, please. How can we help a loved one who is going through domestic violence? Let's support the individual. At times, the individual may not even know that they are going through abuse. But if we're able to communicate or have the victim recognize that they are going through abuse, that may be a first step. Let them know that help is available. Let's not be judgmental. Let's not ask them, what did you do to cause the man to abuse you? If you had kept, I've heard a pastor say, if you've kept your mouth shut, the man would not have beaten you. There is never an excuse for abuse. And so as we interact with people who have been abused, let's be kind. Like my sister have said, let's be kind to one another. Let's maintain safe communication. Because if the abuser knows that you are trying to enlighten the victim, that may spell trouble for the victim, more trouble for the victim. And please do not be afraid to call 911. You can remain anonymous. Just call 911 when you know someone is going through abuse. Next slide, please. And I would like to end this session with talking a little bit about some of my experience in working with women and personal experience as well. In my own case, I came in here, I didn't have any relation. The only relation I knew was the abuser and the family of the abuser. I was given an ultimatum to leave the house. All sorts of things were told. How I was inferior to the wife of the brother just because the person was born in a foreign country. And I was given a day to leave the house. I had a barely 2-week-old baby. I had no job. I had C-section. I just had C-section. Nobody taught me anything, but I believe it's divine intervention. I was given a book at the hospital, and I turned and I found a place for help. I called and I asked, can you help me? I need a place to stay. And before I left, I took the documents, relevant documents. Nobody taught me that. And I stepped out in that cold. It was December, deep cold, this December period. Snow was outside. I had only a house slippers, no coat. In fact, I was told to leave. And I somehow looking back, and I was thinking maybe they really didn't mean for me to leave. I don't know. But if they didn't really mean for me to leave, it's also another form of abuse, knowing that I didn't have anywhere else to go to. I stepped out. I had the courage. I don't know what gave me the courage, but I had the courage to step out with a barely 2-week-old baby. And I want to encourage you. If you are, I suffered physical abuse and emotional abuse. If you are in abusive relationship, please call me. You can talk to me as someone who speaks the same language with you. I will know. I will understand. I came from Africa. We share the same culture. I would know. And I want to tell you, during that period, nobody wanted to associate with me. I was treated as an outcast in the society. That is the unknown part of it. And that may be part of the reason why some people choose to remain. One of the clients that we served, she didn't want to leave. The police came in. She didn't want to leave. She said, I have no one else to provide for me. He is my only support. How could I leave? And that's why it's difficult. It can be difficult to leave. Some people it's because they don't have the immigration paper that they need. But for those individuals, I want to tell you, there is provision in the law for you to gain the paper to live in the country if you are undergoing domestic violence. There is help. Let's utilize the help. Let's not continue to live in violence. And for the abusers, some of them may not know that they are actually abusing, and that's especially when it comes to psychological, and that's why this opportunity is so tremendous. I am so proud of your community for bringing this to light, creating awareness about these two topics that we shy away from talking about. Thank you so much. Thank you so much. And I'm hoping that we will have less deaths in our community, even as we continue to talk more about these issues. Thank you so much.
Thank you very much, Ngozi Akubwike. You've done the community a very nice service. We appreciate your presentation. It was so emotional. So many people who are watching this particular live show on KDR TV, some are asking for you to be coming every Sunday, you three ladies, and we are wondering, hey, will you manage actually even to get time and come and discuss these very critical topics? It's true. People are suffering. You've relieved it, my sister Ngozi. And it's a great opportunity and honor for you to come and actually speak out. You did not try to hide anything. You know, some of us thought you are actually going to break down, but you made it possible by the grace of God to speak your mind out and tell us more about domestic violence. We've got very few seconds or minutes actually to give you guys an opportunity to answer some of the few questions we have lined up for you. I know you are tired. The presentation was supposed only to take like 2 hours maximum, but we've stretched it at KDR TV because we also a community initiative stream or TV. We are also going to bend our laws and allow you to answer a few of the questions before you do your closing remarks. So the question on the screen right now is from one of our community leaders or member called Edith Kirubo. She's asking specifically, three of you, it doesn't mean that it's a question for Ngozi, but the question is, can you also talk about domestic violence in relation to children? So in this particular aspect, what she really wants to get is, are also children affected in this particular quagmire? Because we also, I mean, most people think that this is only affecting adults. So what's your take? Let's start from Ngozi Akubwike. A few seconds to answer that question as we roll up to, I mean, the last person to take the question is our sister, Nelly Toroli. Go ahead, Sister Ngozi. Are you muted, Sister Ngozi?
No, I am not.
Go ahead then, go ahead.
Domestic violence affects children tremendously in the negative way. You see them, they start acting out. You see them hitting children, even in school. You see them, like the story I told about a child that was beating the sister, saying that's how mommy beats the child. That's how daddy beats my mommy. It can affect because there is no stability in the home. A child needs stability in a home in order to thrive. You find the children not thriving as they ought to in their academics. It affects their social behavior. In some families that I have worked with, you find the children afraid of their father, not having that relationship with their father. And especially for daughters, they need the relationship with their father. And the sons as well need that relationship with the father in order to have an example of how to live in life. And so that way it affects the children so negatively. And when there is an abuse against a child, the state has another forum for that, and that is child abuse. Thank you.
Sister Judy, what's your take?
So, as a child who grew up in a home where there was domestic abuse, I have to say, most of the time the children are also abused in one way or another. It's either physical abuse as well and emotional. There's a verbal abuse, and so as a child, and even statistics actually do show the people that were actually struggling more with suicidal ideation and the depression are actually the younger generation, the adolescents, the younger adults. I mean, all the spectrum people are affected, but most of the time when you're a child in that home, you don't actually have a way. It's either if one of your parents decides to stay, you are still there. You actually have no option. So, and coming up from a community where we don't always share a lot with our parents, a lot of times they actually don't know what is going on in those children's mind. So it does affect the children. As a child who, as I said, who was in that relationship where it wasn't a choice of mine, it causes a lot of issues later on in life. I mean, you will have some PTSD of that memories if you saw your mom being beaten. Those take a while before they can actually probably resolve. So there is also the fear, that there is a lot that the children also go through, and many a times they probably will not be able to express it. So it is always nice if parents can also be mindful of their children, what they are going through. And as Sister Ngozi was actually explaining, sometimes people want to stay in that relationship because they love the person, but also what are you doing to the children? How are the children affected as well? So, and I mean, there's been a lot of research that has been done regarding what happens to the children, especially in their growth part. I'm such a person who loves the brain. So there's a part of the brain that is also affected, the centromere, how we develop also. You actually reduce the lifespan of a child because the quality of life is actually affected a lot. So according to most of the research that was done in India, they saw that some of those people can even lose a decade just because of those children are not able to develop and divide. Their cells are not able to divide like they're supposed to divide to get to the adult really life like other children who did not have that exposure. But that doesn't mean that because you were handed down that you should lose hope or give up. I mean, we serve a God that is, doesn't know impossibility. So he provides the healing, and there is a lot that he can do around, especially with children. I always believe that even when they thrive in that kind of environment that is not good, because some of the parents don't actually have a place to go, they still actually make it in life. And most of us are here now giving that experience and sharing with other people who have gone through the same, and telling them that, hey, you know, you are handed down something, but it doesn't define who you should be in the future. You can choose to do it otherwise.
Thank you very much. What's your take, Sister Nelly?
Just like my co-presenters have indicated, domestic violence does impact the children immensely. Remember, we are talking about young kids whose brain has not fully developed. So with constant exposure to that violence, children are growing up in an environment that is not stable. Love is not being expressed because there is an abuser there, whether it's the father or the mother. So children are constantly in a hypervigilant mode. They're not sure what is going to happen next. And we know that can affect how they grow. In fact, what most of the studies that have been done, one of them being the very big study that looked at the ACEs, which is the adverse childhood experiences, really attributes domestic violence is one of the attributes that really talks about that affects a child development, which ends up causing a lot of mental health symptoms even later in life. So here we are talking about really exposing a child to trauma. So when we talk about trauma, that is really what we are talking about. You're traumatizing that child when you are having fights in front of your children, whether it's physical, whether it's verbal, even just neglecting a child, that does impact their growth. So we see children regressing. I know we've talked about the growth part for a child who's been exposed to domestic violence. So you can see, other symptoms like a child even who had outgrown even bedwetting. All of a sudden you start seeing that. Or you just see a child, all of a sudden, they start sucking their thumb, or, there's all these physical symptoms that you start seeing, and others also may be emotional. Child, even they can end up being bullies themselves because they have a bully in the home. He is a father who is constantly abusing the mother, or vice versa. So there are a lot of symptoms that we've talked about that are actually linked to mental illness, because they usually even later manifest in life. So if they are not addressed earlier, as Judy said, the beauty is that once we recognize and we intervene early, children normally have a way of bouncing back. All they need is really to have that secure environment, and they can build up and again regain. So we just really want to be that safe harbor, that haven for our children, to be able to feel that we are there for them and provide trusting relationships. So we always have to be constant of even how we are exchanging our words in front of our children. I know sometimes it can happen without being conscious, but we need to be more intentional to know how this can affect children. Many times you find a child all of a sudden doesn't want to sleep in their bedroom by themselves, and you wonder. And as parents, because we are not knowledgeable on how trauma can affect our children, especially when they're exposed to things like domestic violence, again, you start punishing that child. Why are they not wanting to sleep in their room? Why are they constantly complaining of these headaches? Why are they not doing their homeworks? Without looking back and really, again, analyzing why is our child growing up with symptoms that we never used to see. So we always have to be intentional in terms of recognizing those symptoms in our children and being able to support them as they continue to grow by providing safe and secure environments.
Thank you very much. Thank you very much. Can you hear me?
Yes.
Yes.
Thank you very much. Okay, now looking at the two topics we actually had today, mental health and domestic violence, those things are actually intertwined together. You cannot separate the two. There's no way we can actually separate the two. But now there is a question, the last question, because of time, the last question we're actually having down there. I don't know whether Sister Judy, you can read that question, and whoever, if you want, all of you want to take, answer it, that's perfectly okay with me. So can you read that question, Sister Judy, and then we can, we can start with you.
Yeah, thank you so much, Collins, for watching. And your question here is important. It asks, how can I detect a mental health breakdown in a family member? So I have to say, my take is this. There is mostly we talk about behavior. So you're going to find out that the family member is trying to avoid to have that conversation. So they just want to be left alone. They need a lot of alone time. I mean, we all need an alone time, but they are always avoiding to talk about something. They are shutting down. A lot of times it's like they are stopping to do the things that they enjoyed doing. If you find somebody that is probably depressed, when you're depressed, all you want is just your comfort zone, your bed. A lot of people who are actually depressed don't even have to spread the bed. They just wake up from there and straight go back into that same blanket. They might not even brush their teeth. They might not even shower. When I talk to some of this, the patients, and I talk to people who are struggling with this, I say, rejoice on those little things. Like, hey, I woke up today, I brushed my teeth. Celebrate the small moments, which are greater at the end. So they are going to avoid that. They don't want to do the things they used to love doing. Their mind gives them this picture of hopelessness. In other words, it's you're thinking that things are not getting any better. They are not able to think and say, hey, this can get better. So for instance, they did a study which said if you give somebody $300 an hour before they committed suicide, at that point you give them $200 and tell them to come for it in 2 weeks, or give them $30 to take it at that time. What are they likely to choose? The study showed that they will actually take the $20 then, because to them, they don't see that future of the 300 is more money in 2 days. So it's a lot that their mind at that time, they are not able to express a lot. So you're going to see that even the things that they knew an answer to, they're struggling with that. So I think a lot of it is more behavior, more observing, and more trying to understand their flat affect. We call it flat affect, like they were smiling people. They're avoiding the eye contacts. They don't even want to, talk. Especially, I say, the women who have just delivered children, a lot of them go through a lot of postpartum depression. And sometimes they can just, not even want to have the child around. They just feel exhausted and fatigued and just don't have the energy to do anything. I'll let my other sisters to add on that, because I mean, there's a lot that I can talk about in a day.
I can add to that as well. I think when we talked about the symptoms for mental illness, one thing that I remind folks, if it's a family member, like Collins is asking, your family member better than anybody else. So whenever there's any change in behavior, any pattern that is out of the norm of what you're used to seeing your loved one, then you need to start questioning. And one thing also is you need to start noticing. We talked about most of the mental health symptoms. When we talk about mental health symptoms, when you're evaluating someone or you are making a diagnosis, you need to see how are those symptoms recurring? How often are they recurring? So when you see that they're continuous for more than 2 weeks, and then also they are compounded by someone not wanting to do what they would normally do. Remember, we talked about functioning to your full potential. Let's say you're going to school, all of a sudden you're cutting school. You're working, you don't want to go to work. You're not meeting your tasks. So there are things that we can look at. What are some of the change in behavior, actions, or your body? You hear more of the somatic symptoms. We call them somatic because, they're more like stomach ache. Someone is always having all these unexplained headaches. The body aches, and then you're just having chills, or someone is just losing weight, or just catching a cold over and over, and other emotions also. Something small just triggers an outburst, short temper all of a sudden. And you find, you're just having all these suicidal thoughts, as Judy said, where you just are giving up your possessions, or nothing matters anymore. You don't even want to groom yourself. You need to shower and look good. So there's a lot of physical things that you can look at that can really also help you to start noticing that there's something happening. And at that time, you really want to intervene without wasting time. I know many times we just try to dismiss, or this and that, especially now during this pandemic. People are responding differently to the current pandemic. So we need to notice, we need to be conscious of what are people hearing and how are they responding. Others, even just watching news can trigger some of those symptoms. So let's always be mindful. What are the behaviors we are seeing? How is the body reacting? What are some of the emotions? And also, how is their thought process? Are they in time, in terms of what your thought and the time? Everything has to align. But if you find the things you're talking are bizarre, your memory losses, and the things you talk, you'll get disoriented. That is also a red flag. So we always have to be reminded of that. And once we see that, then we need to connect with the available resources that we talked about, and there are others that we have in Minnesota here especially. And I always remind you, always, if you're able to get someone from your culture who can also understand, looking at what those symptoms are from your culture and how you perceive them, please always let that be your priority or your preference, or at least find out if that provider works from individuals from your cultural background. Because sometimes it can be overwhelming when you have a loved one trying to cope with their mental health symptoms, and then you're seeing a provider that is doesn't even understand how to go about that situation.
Do they sleep a lot?
Okay, go ahead.
Do they sleep a lot more than they used to do? Do they eat a lot or not eat at all, or not sleep at all? So those are some of the signs that you want to watch out for, or trying to give out their possession, like my sister says, as if everything is coming to an end.
Thank you very much, Ngozi. Now let's start from Torori, then we finish with Judy. Let's do our closing remarks, please. Thank you very much. Let's start from Ngozi. Your closing remarks, please.
I just want to thank everyone, thank the community, thank KDR TV for providing the platform, thank my co-presenters for an awesome job that they did, and let this just be a beginning. I see this just as a beginning of creating awareness. Let's continue the conversation. I know from where we come from, we try to keep things within the family, but at times there are things, like I always tell people, you need to have someone you can confide in and seek help. Get intervention before we have a crisis. Thank you. I hope, again, I'm so grateful for this opportunity and the conversation that we have had, and I hope we continue that conversation in our different sectors. Thank you.
Thank you, Sister Nelly.
Thank you as well, Wanyagetinga, for the opportunity, KDR TV, for being able to provide the platform for us to share what we have shared with our audience. I really want to remind us that mental illness is real, and especially at this time of the COVID pandemic, we are seeing a lot more people responding in different ways than they would normally do. So my challenge is that we really need to get beyond the stigma. We need to know that mental illness does not discriminate. Anyone can get it. So, and again, we need not to be ashamed of mental illness. Or if one of ours is having it and want to hide it under the rug, please let us support our loved ones. Let us seek intervention earlier so that we can be able to mitigate some of those symptoms before they escalate further. So let us continue these conversations, and I hope as we, KDR TV has provided this platform and others, as we continue to raise awareness around this crisis, because really mental illness right now is at a crisis level, especially as it relates to COVID-19, so that people can be able to openly speak about what they are going through and be able to seek help without feeling judged, or at least feel that without the shame or feeling that they have failed in one way or another. So as a community, let us all come together and have these conversations boldly and support those of ours that are struggling with this. And also our children. There's a lot of changes that are happening now with COVID-19. The new norm is not what we have been used to. There are children at home. That can raise a lot of stress. I know sometimes, especially in home residences where we may not have enough space, where we are stepping on each other's toes. Let's be kind to each other. Let's try to be understanding. Let us try to listen to our children, what they are going through. They are trying to deal with this situation differently than adults. We may know how to mask the symptoms. Children, most of their symptoms are manifested through behaviors. So whenever you see behaviors that are not normal, please let's pay attention to them. Thank you so much, and I look forward to having continuous discussions on this, and as we look at strategies to address this.
Thank you. We decided actually to ensure that the soup, the top soup or the sweetest soup, remains for our little sister, Dr. Judy Onduso. So what's your closing remarks, please?
All right, thank you so much, Kibwata there, Elder there, and Mwanya Getinge, and the, Hennepin County, and everybody else that has made it very possible, the viewers and the people asking great questions and encouraging us to continue providing this information to you on this platform, because as we share this information, it also becomes therapeutic to us. So thank you again. And one thing I didn't mention to Brother Colin who asked is, anytime you are in doubt, you want to error on the time of calling a provider or asking somebody to say, hey, I need my loved one to be looked at. There is a lot of stigma and also lack of understanding how the system works. A lot of people are always afraid, like, hey, if I went into the hospital, they're probably going to commit me, or they're going to do a 72-hour hold. As a person who works in those kind of setting where we have like crisis hospitalization, we honestly will not be able to hold you if we as providers felt like you don't need the help. The county will never support it. The Medicare, all these insurances don't. So we don't want to hold anybody hostage. Anytime that somebody is going to say, hey, we need to have you here for 2 days or 3 days or this while we figured out, we're trying to understand, like Nelly was explaining, is this something that has been a reoccurrence? How long has it been? So that we can give you the help that you want. And I do know that I'm glad that Sister Ngozi was honest, because we also are battling a lot of legal issues whereby somebody says, hey, I don't want to go in for mental health problem because somebody might use this against my children and take away my children, because they'll say, hey, you are depressed or you have this mental health, then somebody's easily going to take a child away from you, a family member from you. And I wanted to say this, in the United States, it makes it so nice that we have HIPAA. In other words, I cannot be able to disclose your information to anybody, not even your own, you have to tell me who you want me to disclose the information to. Occasionally, so feel free, come in, and we have mandated providers, and some of those people, if I had to come to your place and I felt like something was wrong, as mandated providers, we can do that, not because we care, and we understand that if you got this help, we can save our lives. So our goal is to save as many lives as we can. And I just wanted to say to each one of us that, hey, the journey we are in, there's a lot of adversities, and just be fearless in that face of adversity. A lot of us have learned to have some resilience and, have look for shoulders to lean on when we really are not, in our highest, way of functioning. So don't be afraid. You're not alone. And for those, the stigma, people will think that, oh, I can't have this. Like I said, look at Abraham Lincoln. He was struggling with all the depression he could, but he was the president that actually was very passionate, and he did things that he wanted to do. So people that struggle with mental health are not they shouldn't be looked at like, oh, you are a mental health illness. They shouldn't be looked at as people who are a disgrace to a society, or they are never loving, they are this and that. It's not true. That is a myth, and it should actually stop. That is making it very, very difficult for people to get the help that they need. Like I said, in a world where you can be anything, choose to be kind. Choose to lift somebody else's hand. Choose to be mindful of others. do unto your brother or sister what you want them to do to you. So, I mean, be nice. It doesn't hurt to be nice. And also be vigilant. Know your surrounding. Feel, even if your sister felt bad that you called a provider and said, my sister need help, if you will have saved that life, because we know, as statistics shows, a lot of people who actually even commit suicide have never even been diagnosed with a mental health illness or disorder. So some people might never show up. We might never be able to diagnose them. But if your gut feeling says something is wrong, act on your gut feeling, save our life, because that is our goal and that reason and purpose we're still on earth. I wish you well in your journey as we in this storm. Anytime you are low, call any one of us. Let's talk. And thank you, President Hulda Momanyi, our president of Manyagetingi as well, and all the things that you are doing for our community in order for us to have this kind of platform. Thank you so much again, everyone that makes this possible. Edith also, and I can thank all of you on air, and I'm so glad that I was able to get this opportunity today.
That brings us to the end of this presentation from our lovely ladies who have actually taught the community. Lots of, they have impacted us a lot, especially on the mental health, domestic violence. And, this stream is also going actually to be used by professional bodies, even schools. It's something which most people are going to cite because the information was very insightful, very precise, and to the point. So thank you, ladies, for accepting to be part of the of this conversation, especially on the COVID-19. Now it has actually affected our families. And next time we are also going to invite you, even if you will decide to come 3 or each person. We'll definitely be very glad to have you again in our stream, and may God continue blessing you, your endeavors, and your families. Till next time, from KDR TV. And before we actually close down, let me also recognize the Manyagetingi leadership led by our able sister called Hulda Momanyi. Our entire executive team, followed by Menya, Dr. Chris, and then we also have our brother called, I'm forgetting their names, but let me actually say the entire team, going down to the county reps. Thank you very much for making it possible for us actually to have this particular conversation. My name is Omweri Kebwato, and from KDR TV, I say thank you very much. Let's meet next time. And the ladies, wonderful ladies, thank you for being with us, and may God bless you.